Hi, this is Patty and Rada with HIMSS TV. I'm here today with Daniel Colling and Raja Bhadury from HP. Thanks for joining us today.
Thank you very much, Patty, for having us today.
What is HP doing to address the COVID-19 pandemic from a patient and clinician safety perspective?
There's multiple facets that HP has been able to leverage their technology to truly help the frontline workers, as well as accelerate research, specifically in regards to a vaccine. With developing our 3D print technology, specifically the multi-jet fusion technology, we've been able to 3D print over 9,000 face shields. And one thing that's overlooked is clinicians, they're working 16 to 18 hours a day. And wearing those masks, they start to really chafe on the ears. And as such, what we've been able to do is develop a mask adjuster. And we've been able to 3D print a little over 3,000 of those. These have all been donated to over 60 hospitals across the US. The second area that HP has partnered with Prisma Health, which is out of South Carolina. And what we've done is we've partnered with them to develop a ventilator expansion device. And with our technology and our vast experience of developing 3D parts, we've been able to work with USC, which is out of Greensville, specifically with Dr. Tilkemeyer and Dr. Patel, who's their Chief Digital Officer, to share best practices on developing an expansion device that really would allow two patients to share that same ventilator. It is important to note that matching the clinical characteristics of the patients connected to that single machine to deliver the same settings like oxygen concentration or amount of air in each breath. That is one of the areas that we're working specifically with now that we're through human clinical trials. And this was the first FDA-approved ventilator expansion device. The third area I wanted to highlight really quickly is it's going to be really critical to have some method or some type of vaccine when we hit some type of normalcy with this global pandemic. And what we have at HP is we, being the leader in fluidic-based micro systems, we developed the first digital bioprinter in 2018. And as such, we've been able to utilize that same technology to collaborate with the CDC in 2019 last year with accelerating testing for really resistant antibiotics and bring those to market. And now that the pandemic has hit, we've been working with labs throughout the US and throughout the world to accelerate that vaccine research. And they do it in three ways. It really saves a ton of time. It eliminates the serial dilution using those workflows of our digital dispenser. Secondly, you're able to miniaturize qPCR assays from picoliters to microliters to dispense volumes. And then the third is, for example, with Menlo Park Labs, which is in the Bay Area, we've been able to really speed the research and provide reliable, stress-free operations, meaning they don't have to do the hand pipetting anymore. So we're combining robotics with our digital dispenser or bioprinter to accelerate that. And they're thinking, they could accelerate that from 12 months all the way down to 6 months when it comes to developing a vaccine. The last area is HP. We have truly built a healthcare portfolio that is dedicated towards patient safety, clinical efficiency, and care coordination. And very important now with a lot of clinicians working from home that are non-patient facing, security.
Can you tell me more about what HP is doing to make it easier for clinicians to care for their patients in these non-traditional care settings?
Securing data and devices are a challenge even during the best of times. And now during this pandemic, when we have so many people working from home, when you have clinicians, working in these novel ICUs that have been created in parking lots and convention halls, cybersecurity obviously is a huge, huge thing to look out for, right? And the bad actors are more active than ever, unfortunately. Now, HP has a multi-layered security approach when it comes to its PCs and printers. So what that means is we protect the PC under the operating system, at the operating system level, and above the operating system as well. So let me give you a couple of examples. HP Sure Start is the industry's first and only self-healing BIOS. So the BIOS, or the firmware, is deep within a PC. And if it is compromised by malware, then the entire PC it's just devastating for the PC, right? And so HP Sure Start protects it at that very, very deep layer. We've all heard of phishing attacks. When it comes to cybersecurity threats, phishing, where you have, again, these bad actors sending malware through attachments or via email or the web, is really a huge, huge problem. And so with HP Sure Click, we've set things up in such a way that the attachments are opened up in their own virtual containers. So if there is malware embedded in the attachment or on a website, then the PC itself is still insulated from it. And the moment the attachment is closed, the malware disappears. It doesn't remain in the system. And then one other example I'll share with you is HP Sure View, which is above the operating system. And with HP Sure View, it's a privacy filter that can be toggled on and off. So it's an integrated privacy filter when clinicians are working in very crowded settings where they may be non-clinical staff who should not be looking at protected health information. They can simply turn the privacy filter on. And on the other hand, when they want to collaborate and share the protected health information with their colleagues, they can simply toggle the privacy filter off thanks to HP Sure View. So those are some nice innovations that, again, help us at HP play a more proactive role in protecting the PC, and then also help recover more quickly from breaches.
With this pandemic, there's been a surge in telemedicine. How is HP enhancing the telemedicine experience?
Yeah, telemedicine is huge. We have a few customers right now who've told us that their telemedicine or e-visit encounters have gone from maybe a few dozen before the epidemic to literally 2,000 or 3,000 a day because of this epidemic, right? And HP has this long history of really enhancing collaboration in enterprises. So we've taken that expertise, taken that technology, things like HP Audio Boost, which enhances the voice quality, or HP bidirectional noise cancellation, which really removes or reduces the background distractions and noise. Our HP Healthcare Edition products have a full HD camera on them, which is really good enough for most telemedicine encounters. But then beyond all those hardware innovations, what we've done is we've worked with an ecosystem of telemedicine vendors who are really leaders in this space. So take VitalNet, for example. Over and above any regular collaboration software, what VitalNet offers is a very secure, HIPAA-compliant, scalable cloud platform that's also deeply integrated into the EMR, into the electronic medical records. So that's really, really nice for clinicians. It really streamlines their clinical workflow. So these are the kinds of things that we have in our Healthcare Edition products, which make them smarter. They just help clinicians do more things more quickly and have a better experience, both for themselves as well as their patients, on our HP Healthcare Edition products.
It's all really interesting, and that's great to know. Thank you, Daniel and Raja, for joining us today.